tricky one to get to because we're only going to be utilizing half of the foam roller itself. What you're going to do is put the foam roller down, you're going to lie down, and then one arm on top. So the end of the foam roller hits the bottom part of where your sternum lies, this big hard bone. It's going to hit slightly lateral of that, so bring it out where your pec exists. For women, you're only going to be able to get to here. You know, only the top portion. And then you're going to have to do the rest through stretching. And I'll explain that later. So, for men, all the way through. So you're going to hit the bottom part, here. Allow the arm to drop. Here, here. Go back into our other position. And then just roll down. Now notice I'm pushing with my toe up or I'm rolling down. Hand relaxed, rolling down. Push up with this hand to roll you down. Everything through. This arm is nice and relaxed. It's rolling through. So what we're gonna do to stretch through the upper back is, everyone knows about this one. This one does barely anything because it just lacks through here and gets the deltoid, the posterior deltoid, but majority of the time it gets clumped through here. So what I want you to do is bring the elbow across the body and grab as far back as you possibly can through here. Once you grab that, grab the opposite arm and then just roll through and then roll down, like roll your body down. So grab as far as you can, grab back, roll through. So you're rolling through, you're pulling everything out, and you're gonna instantly feel some of the stretch right through there. Driving in your car, you can't turn out that left side. You have trouble going here. This is where majority of people don't realize that a lot of people have left issues because their right sternocleidomastoid is always contracted. It has a resting tension weight higher for many different reasons, but we have to get you to recognize that's always gonna be there, so you wanna clear that out. And also, this is something that a lot of people don't recognize, is if you're a heavy breather and you do a lot of fight or flight, and you're panicky, or you're a person that has asthma, this muscle is always going to be triggered because it also helps with breathing. And by it helping with breathing, it pops you up. See that? It rolls your head forward. With both of those, you not crimp the rest of the neck itself because it repositions your body. If you're out here, your head has to shut close. So we have to get you out of this into a natural state and get you to start knowing that lower belly breath. Rotators. What you're gonna do to get all your neck rotators and neck movement all together is you're going to get your suboccipitals. What you're gonna have to do is grab the occipital ridge. It's like you're grabbing the back part of your head. Again, lock the shoulders down either manually or try to grab the back of a chair. And now with that hand, just pull on the skin and let that guide you down. And because you had that little bit of tension there by you poking at it, your body's going to force the stretch right through there. And that's where you're gonna get it through. But don't just wrench it because that would hurt you. So you want to now slowly roll through and you're gonna feel this part opening up, this part itself. And then at this point, you can start looking up and down to see what muscle tissues you feel firing off. And then depending on which ones you use more in your eyes, you'll feel that contract. You wanna work with that in the opposite direction. So I can't show you, look your way up, your eye up, and this muscle is gonna go through. This is something that you're gonna have to feel out. The more you can feel that out, the faster you'll be able to clear all these up, and then you'll be able to move through, as well as you'll be able to see better. Just run all the way through, all the way up to the tip of the top of the head. So you have to utilize all of this aspect. So there's different bending sites for your back. So there's gonna be different tightening positions for this muscle alone, all the way through. So this protects your spine. If you don't get all the structures around it to start learning how to move, these backboards are not gonna give. They're not gonna move at all. So if you have back pain, remember, you have to clear out everything. Everything. You get everything to start learning how to work before it becomes an unconscious habit that your body just goes. You need to start getting everything to start working together before you can actually utilize these by yourself. If you go to a therapist of some sort, they can help you with that. There's chiropractors, things like that have lasers that can get to these areas very, very efficiently. There's some skilled therapists that can actually do body work and hand work there. But all in all, I say let the body do all this intricate work. You just have to focus on getting everything else around it, and all this stuff will clear up. So now, this is how we get through to the erectors, through serratus posterior and quadratus lumborum. What you want to do is take your handy ball, that's going to give you your erector. And as you get better at getting the erectors to go away, you'll be able to go through the erector to your quadratus lumborum, and that's when you start to get the deeper fibers of quadratus lumborum. Upper traps is where you get the broader spectrum. Now notice traps run this way as well as this way. That's why it's called the trap, trapezoid. So think about it as you just want to point and hold, point and hold, point and hold all the way through. As you start to get better and better at this, things will start to change. You'll hit different fibers on the next level. Lower trap gives you referral patterns all the way through here. Now notice something as low as this, giving you neck tightness and possibly a posterior headache, okay? Notice something down here can give you the headache. Neck tightness, headache. You wanna be very, very clear about that. Mid trap, right smack in the middle. This is gonna be a very important spot for you because there's two things that run through there. That's gonna be very, very important, okay? Huge. Mid trap, right smack in the middle. Lower trap, up into the head. There's many different aspects that's gonna give you many different issues, okay? Serratus posterior superior is gonna be really tricky because it lies underneath your scapula. This trigger point is always on fire because everyone's rotator cuff is shot. Everyone's scap is pinned to their rib cage, not allowing them to breathe. So as the scapula pins against the rib cage, it crushes this bad boy. So this, actually, you see how it's very, very close to the other spot that we were talking about before? Now this also refers a lot of malfunction upwards. So when you can't turn your head, when you can't raise your shoulder, all that's being driven by this. This is gonna be very, very hard to do, which I'm gonna show you. It's a trick to get to this, but it's very, very easy to miss if you don't ever make it through in the first place, all 3 layers into this deep layer. I'm leaving this slide up on purpose because I wanna show you, I want you to understand that serratus posterior superior needs to be worked in a different manner. You're not gonna be able to get through this bone. You're just gonna irritate it. Now, this is a whole completely different ball game. I'm gonna show you that next. But we have to now stay from spine, between the spine and the scapula. That's where we're gonna run the course. We're gonna run the course all the way up and around. And the easiest way to do that is so I want you to think about it, just feeling what's going on. But look and see, this is what I just hit. Know that you have to go through your traps first, your rhomboids, then this bad boy hits. So you have to take your time. I've been doing this for a long time, that's why I got it so quick. So don't think it should happen within a moment's notice. And if you do get it, you're not gonna like the feeling of it because it's so sensitive. So take your time with it, it's very important. This is a very important area. It's very important because this is our second foundation out of the 3 foundations I'm gonna be teaching you. So we already have our feet taken care of. We have a shoulder girdle that we're going to be working with as well. Now we are working with our second foundation. We're going to work from the side of the hip, the front side of the hip, all the way around the back. So we're going to hit the glutes. We're going to be hitting TFL. We're going to be hitting a lot of different objects. TFL has trigger points right in the front of the hip. This is a lot of people get confused with. If you touch the very point of your hip, and you move over just a smidgen and then run down to your hip bone, you're gonna run right over it. So this runs through and also becomes part of your IT band. So if you're having IT band issues, it could be your quad, it could be your hamstring, this bad boy, or your glute all together. Okay, that's why it's very important to hit all these areas when you're foam rolling, hit all these areas, and then go after your IT band. Because if you go after this, and you don't officially clear out all these other areas first, IT band's always gonna hurt. Always gonna hurt. That's why people say, it always hurts, because they never clear out everything first. So I'm gonna teach you clear out everything first, then go after it. It should be cakewalk. It's the point part of the hip, okay? You're gonna put it laterally, put the point part of the hip, placed against the wall. And that's your whole entire glute. You just did that whole glute in less than 2 minutes. Make sure it moves. Ow, it just moves, it flies. That's what you want, okay? So, to become more active, I have to show you how the muscle tissue works so you can actually start utilizing it more effectively. Here, you have to recognize the fiber composition of the pec by the clavicle. So this is the clavicular fibers of the pec, attaches up top here. When we're doing the treatment, I'm hitting every area around here because this is where pec minor exists as well. So I'm hitting a lot of the clavicle function fibers. Now notice it attaches to the arm itself, right underneath where the bicep is. So a lot of people that says I have bicep tendonitis, it's not truly caused by the bicep. It's actually caused by the pec. And a lot of people don't work the pec well enough. So pec is humongous important because there's fibers that I address through here. We do this all the time. Pec minor, these two fibers right through here. Runs right through here, attaches through here. Sternal fibers, lower pec here, up here. So what I want you to do, it's gonna be key for you to get all the area, but it's tricky because you're so close to the wall and your body's gonna want to move against the wall. You have to get comfortable in close surroundings like that so you can actually open this up. But after you do this, we're gonna be doing the majority of the pec work through stretching. This is your calf. Your calf has two heads. You see that? It's two distinct things. There's your outer calf and the inner calf. Depending on what happens in the ankle, one of these bad boys are going to be more developed. That means one of these are going to now have more tension ratio. The majority of the time, it's the inside, but the outside screams bloody murder when you hit it. The soleus itself lies underneath the gastroc itself. This is something that's called your second heart. This one's very important for us because every time your calf beats and squeezes on this, arteries underneath this get squeezed and the blood flow comes out of your foot. So if you're swelling in your feet, if you always have sore, tender feet at the end of the day, get this one to start moving and contracting better, poof, all that will start moving and circulating more and more. All the soleus does is get the ankle to move through. So it's a plantar flexor, that's it. So if you're having trouble with this, soleus. But foam rolling, we already discussed, is all about moving slowly, angle, weight load. With the calf itself, we want to start utilizing the foam roller on the floor, and it's all based off your upper body strength actually. So you have to learn how to do a little bit of maneuvering for your upper body strength. What are we going to do here? Every time you do something, I want you to start getting up and moving. Getting up and seeing what you did. That's so important. Because what happens in your brain is your brain notices, oh wait, I just did something that my body's enjoying. Let me do more of that. And you notice what that feeling is like. So in this whole beginning portion of it, you have to learn how what you do affects you instantaneously.